Role of ultrasound in the obstetrics is an essential role in the obstetric care used for confirming a pregnancy, fetal monitoring, anomaly detection, and assessing the maternal fetal well-being. Types of ultrasound in the obstetrics: transvaginal ultrasound used in the early pregnancy 4 to 10 weeks for the better resolution. Transabdominal ultrasound used after 10 to 12 weeks for the fetal assessment and the growth monitoring. Doppler ultrasound evaluates the fetal circulation and the placental function. Role of ultrasound in the different trimester. First trimester 0 to 12 weeks. Conflicts of pregnancy detects the gestational sac 5 weeks and fetal pole 6 weeks. Viability check. Fetal heart activity seen at 6 to 7 weeks. Gestational age estimation. Cron rump length is the most accurate in the first trimester. Detects the multiple pregnancy. Determines the chronicity and the amniosity in twins. Ectopic pregnancy diagnosis. Help detects the extrauterine gestational sacs. Molar pregnancy detection shows the snowstorm pattern in the complete molar pregnancy. Second trimester 13 to 28 weeks. Anomaly scan 18 to 22 weeks. Detects the congenital malformation, neural tube defects, and the cardiac anomalies. Fetal growth assessment by parietal diameter, femur length, abdominal circumference used for the fetal weight estimation. Placental location identifies the placenta previa, placental insufficiency. Cervical length assessment help predict the preterm labor. Third trimester 29 to 40 weeks. Fetal well-being assessment, biophysical profile combines NST plus USG to assess the fetal health. Amniotic fluid index detects the oligohydramnios and the polyhydramnios. Fetal presentation confirms the cephalic breach of the transverse line. Doppler ultrasound evaluates umbilical artery, middle cerebral artery, and ductus venosus. Blood flow to detect the fetal distress and the intrauterine growth restriction. Placenta maturity grading assesses the risk of placental insufficiency. Special use of ESG in the obstetrics. Guidance for the invasive procedure: amniocentesis, genetic testing, fetal lung maturity, chronic pillar sampling, CVS, early genetic testing. Diagnosis of the fetal demise, absence of the fetal heartbeat and the movement. Confirms the intrauterine fetal death. This is preferred in the early pregnancy for the better. Gestational sac appears at the 5 weeks and the fetal pole at 6 weeks on the USG. Cron rump length. This is the most accurate parameter for the dating in the first trimester. Anomaly scan detects a congenital malformation. UPT, FI and EAC are used for the fetal growth monitoring. Doppler USG evaluates the fetal circulation and detects the IUGR. Amniotic fluid index assesses the oligohydramnios and the polyhydramnios. Biophysical profile combines the NST plus USG to assess the fetal well-being. USG is crucial for diagnosing the placenta previa, abruption, and the vasa previa, used for guiding the invasive procedures like the amniocentesis and the CVS.